Health officials warn this could be a pandemic. What does that mean exactly here?
Could be is operative is what you have to talk about. Let's take a look at how they do the ratings. Right now on a scale of 1 to 6, they say that this outbreak is at a 3, where there is no evidence of, or there is no or very limited evidence of human to human transmission. Now on a call with the CDC that I was on this afternoon, there was a lot of talk about maybe that might get moved up to number 4 when you see cases popping up in Kansas, probable cases in New York. Maybe there really is increased evidence that this is transmitted not just from pigs to people, but is being transmitted in significant numbers from person to person.
Okay, so then how sick are these people? Is it mild? What is it? It's very
mild,
serious?
and that's what's so interesting is that in the U.S. the cases have all been mild. There have been no deaths. The cases that we've been told about, only one person had to go to the hospital. They didn't even need antivirals. So it's been mild here. Not quite clear why it seems to be worse in Mexico, why people seem to be dying in Mexico of this and not in the United States.
Okay, then tell us a bit about this new virus. What makes it unique? Because, you know, we've been hearing about bird flu. We've heard about there was SARS and, monkeypox and all these things that pop up and then they go away. So tell us about this one. What makes it unique?
This is a unique combination of actually 4 different viruses. Wow. You can find DNA from 4 different viruses. So let's go over what those 4 are. North American swine influenza, avian bird influenza, human influenza, and a form of swine influenza that's normally found in Asia and Europe. So you put that all together, you get this new swine flu virus. We haven't seen it in this country before, so that none of us has developed an immunity to it in its entirety. But again, at least in this country, it doesn't seem to be, it's not killing anyone, thank goodness. But you or I have never, our bodies have never been exposed to it before.
All right, so the WHO, which is the World Health Organization, they have an alert system. Where are we now with that system?
Level 3 out of 6, that's where we are, level 3 out of 6.
Right. Okay, tell us about the precautions they're taking in Texas now.
Yes, very interesting. In Texas, in Guadalupe County, they have closed a high school where 2 kids have been diagnosed as having this new swine flu, and one other student, I should say, is a probable case. They're closing the school down for a week at least. In addition, they're telling everyone in the county, please postpone big public gatherings. We do not want people getting together in big groups because that's how this virus could spread, and they're being very clear about it. If you are at all sick, please stay home. Do not go out. They really want to catch this and nip it in the bud before this gets bigger than it already is.
Yeah, I'm just watching all the information coming over, new wires coming over here as well. This one is from Kansas, where we talked about the schools there, New York as well. We don't want to alarm people, but when we saw SARS, people got sick and died, and then we saw, as I said, monkeypox and bird flu, and then these things just kind of went away. How concerned should we be here?
I mean, it is possible that that could happen here as well. Again, the cases that we've seen, 10 cases, these people are mildly ill. They didn't even know that they had anything as strange as swine flu. They didn't even, for the most part, end up in the hospital. I think that's really important to keep in mind.